In the context of executive nursing practice, what is the purpose of conducting a SWOT analysis? A. To identify the strengths, weaknesses, opportunities, and threats of an organization. B. To evaluate the financial performance of an organization. C. To assess the satisfaction levels of patients and employees. D. To develop strategies for effective patient care delivery. The correct answer is option A. Which of the following is a key role of an executive nurse leader in quality improvement initiatives? A. Discouraging staff involvement in quality improvement activities. B. Focusing solely on individual performance evaluation. C. Facilitating collaboration and teamwork among healthcare professionals. D. Ignoring patient feedback and suggestions for improvement. The correct answer is option C. Which of the following is a characteristic of a high-reliability organization in healthcare? A. Encouraging a blame culture where errors are punished. B. Focusing solely on individual performance rather than teamwork. C. Promoting a culture of safety and continuous learning. D. Relying on outdated technologies and processes. The correct answer is option C. Which of the following is a primary purpose of financial management in executive nursing practice? A. Maximizing profits at the expense of patient care. B. Minimizing expenses without considering quality of care. C. Ensuring efficient allocation of resources to support patient care. D. Manipulating financial data to misrepresent the organization's performance. The correct answer is option C.